the hospital, if you're critically ill, all these aspects are taken into consideration and you can go for multiple tests in the hospital. What do you suggest for people who are in home isolation?
Madam, the most important thing I would suggest is that patients who develop correct symptoms, for example, people who get chest pain or symptoms of angina or breathlessness or dizziness, palpitations, they should not stay at home because the people are not coming to hospitals with the fear of catching COVID infection. Those who are already having pre-existing heart disease, and if they develop symptoms, they are more likely to die at home. So many deaths have been reported in New York. They have shown that death rate among cardiac patients was 5.5 times more as compared to the non-pandemic area. The reason was that the patients were afraid of going to the hospital. So whenever they have symptoms of, suggestive of heart problem, they must consult their doctor. If they are afraid of going to the hospital, they can talk to them on phone, they can have a virtual kind of conversation with their doctor. And if the doctor suggests, then they must get admitted in the hospital. There is no harm in getting the patient admitted in the hospital even during the pandemic, because there are ways and means to handle patients and they can be saved. For example, if they have heart attack, you can do angioplasty even in the presence of COVID infection. Even when the patient is having COVID infection plus heart attack, you can do angioplasty. The other thing is that patients who develop arrhythmias, they can die suddenly, and these arrhythmias can be handled very well in the hospital. And those who develop acute decompensation, means those who are having weak heart, and if they develop sudden breathlessness, the acute heart failure can occur in chronically weak heart. And these patients can be saved by giving them diuretics and putting them on temporary support or ventilator. So these patients must not hesitate in going to the hospital, because we as doctors are going to the hospital every day for the last 2 years during the pandemic. We have been going all along, and we don't get infection if we wear 2 double masks. So patients can come to hospital with double masks.
With all necessary precautions, you should step out if you think there's something wrong with you. But yes, most importantly, speak to your doctor first. Thank you very much, Dr. Bansal, for this extremely informative interaction. Our viewers surely are going to benefit out of this. Thank you very much.
Thank you very much.
We're moving on now, and